Hey guys, it's Paul. First of all, thank you to my 1.1k subscribers and counting. And if you haven't clicked the subscribe button yet, now is the time. And of course, don't forget to follow me on my social media accounts. Now, let's start with giving you the content of your board examination. PNLE has 5 subjects, namely NP1, 2, 3, 4, and 5. You have NP1 for Community Health Nursing, NP2 for Care of Healthy or At-Risk Mother and Child, also known as your OB and Pedia. NP3, 4, and 5 are your Care of Clients with Physiologic and Psychological Alterations A, B, and C. NP3 and 4 is basically your Medical Surgical, while NP5 is your Psychiatric Nursing. In addition, these 5 subjects also includes basic skills, fundamentals of nursing, professional adjustment, and research. The examination contains 100 items each subject, for a total of 500 items with a time limit of 2 hours each. For an examinee to become a registered nurse here in the Philippines, they first must obtain a general average of rating of at least 75%, with a rating of not below 60% in any of the 5 subjects. My fellow nurses and soon-to-be colleague, I genuinely understand how you are feeling right now with your upcoming examination. So here are the tips based on my experience. Tip number 1 is to have a goal. Your goal should be to top the board exam, so that you'll land in just 2 options. Either you top or you pass the board exam. On the other hand, if your goal is just to pass, you'll either pass or fail the board exam. It was actually Ate Yema who told us about this. When we were walking around UST, we bumped into her, and so we decided to ask her for some tips since she was a PNLE board top-notcher. And then she saw that I wrote on my review word to pass or to top the board exam. And then she said na, erase the word pass. Your goal should be to top the board exam. Para kahit anong mangyari, magtatap ka or papasa ka and hindi ka madidisappoint sa magiging grades mo after the exam. And yes, I wasn't disappointed, guys. Do you want to know my grades sa PNLE? Maybe later. So what is your goal, nurses? To top the board exam! Parang mahina, parang kulang sa energy. Isa pa nga, nurses, what should be your goal?
To top the board exam!
To top the board exam! A! So yun guys, your goal should be to top the board exam. Tip number 2 is to choose your review center wisely. Factors like, have they produced top-notchers already? Or positive feedback about the review centers, which you should really consider. In UST, we did our review for 6 months. But honestly, since first year, you really have to fight your way up until the finish line. Kasi matira matibay talaga. Then they gave us the go signal to enroll in review center of our choice. With the remaining 4 months before the board exam, I enrolled with Ascend and got a scholarship with APO. I would definitely recommend both since they have produced top-notchers in the past. And I really learned a lot about test-taking strategies from them. Tip number 3 is the materials that I used and should have used. I should have used Saunders Q&A book 7th edition that I've learned that exists when I was looking for a Q&A material for my NCLEX exam. Although I didn't use it for my NCLEX preparation, but when I checked it, it's definitely for PNLE practice exam. I would also recommend watching Simple Nursing and Archery Review on YouTube to easily understand the different topics. Their discussion is direct to the point, so it's easy to understand. I used these 2 channels for my NCLEX preparation and I should have used it on my PNLE as well. Tip number 4 is to study in a comfortable environment to easily absorb and understand your review materials. It's not really going to work if you are uncomfortable with the place, the noise, and even the people around you. Tip number 5, answer a minimum of 3,000 questions before your board examination. This would really help you to be trained well so that whatever set of questions they'll give you from the question bank, you will be ready. Also, whenever you are doing practice questions, you must answer 100 items with a timer of 2 hours. Tip number 6 is to practice proper shading of Scantron without any erasures and prepare 2 pencils for the exam. I have experience having erasures during practice exam and I keep getting higher score from the manual counting compared to the machine count. Remember that the machine is really sensitive to erasures, so practice proper shading without erasures. Tip number 7 is to treat your practice as if it is already your PNLE exam, so that whatever scores you will get, you know that you did your best. Tip number 8 is to do not overanalyze. Focus on the topic, the modifying phrase, and the choices. Do not say that, what if like this, or what if like that? That will put you down, guys. So nope, do not do it. Tip number 9 is regardless of your scores during practice, please focus on the rationale and how to properly analyze each question. Like, why is the answer like that? What did you miss? And then accept. Kasi you also have to understand the fact that we make mistakes during exams and we do not really know everything. Having mistakes naman is a reason to improve, so just keep working on it. Tip number 10 is to take vitamins like ginkgo biloba, B-complex, and fish oil. I researched it before na it can help you with your brain functioning. This is also what I did with my PNLE and my NCLEX RN exam preparation. So if you guys want to try it out, you may do so. Tip number 11 is to do not drink alcohol few weeks before your exam, as it can really affect your performance during your examination. Guys, I know some nurses, or should I say, we nurses are manginginom. I mean, for the sake of the exam, it would really help you a lot if you will abstain from drinking alcohol few weeks before, since it can really affect your neurons. Tip number 12 is to pray. You know what, guys? Kahit hindi ka talaga mahilig magdasal, mapapadasal ka. I even know some who don't even go to church but suddenly went kasi grabe naman talaga tong PNLE kung maka-pressure. Lalo na if you came from a top-performing school. Nagdasal kami kay St. Jude, di ba? Alam na alam niyo yan. And then when we went to St. Jude, nakita ko dun yung mga prayer to St. Rita, St. Anthony, saka kay St. Joseph of Cupertino. And then we also went to St. Clair, yung inaalaya ng itlog. And then pag wala kang dala, itlog na lang nung kaklase mo. Joke lang. Pero meron naman dun mabibilhan. And last but definitely not the least is to be kind to yourself. Go and eat your favorite food or visit your favorite place from time to time. Don't stress yourself so much, guys. And have enough sleep. Let me tell you this. I didn't have enough sleep before my first exam, and then I was performing pretty well on my NP1 in the morning, and then here comes NP2. I am already sleepy, as in talagang inaantok na ako. Then during my NP3 exam in the afternoon, I fell asleep at number 50. Talagang nakakatulog ako at hindi ko na namalayan, and then I woke up when the facilitator said na last 30 minutes na lang daw. Can you imagine the agitation I am experiencing that time na kailangan kong sagutan yung natitirang items na ang goal ko pa is mag-top, pero 30 minutes na lang daw. So after the exam, I told myself na I need to read again para ma-ace ko yung second day kasi if not, hindi ako magta-top sa board exam because of my experience with the first day. Pero after the second day of exam, I then realized na I should have just left early. So I could have concentrated more on the second day of my exam. The ending is, I didn't top the board exam, but I got 87, 81, 81, 80, and 81 for my NP1 to NP5 with a general average of 82%. So please guys, have enough sleep. I really have to stress this out because this is the only thing that I didn't have during my examination. Although sometimes, being a top-notcher is really a destiny. If it's meant for you, it will be given to you. And after the examination, go out with your friends and have fun. Ilabas nyo lahat ng sama ng loob nyo kasi wala naman na kayong magagawa kung hindi nervyusin kakahintay. And I guess that's it for this vlog, guys. I hope this would really help you a lot. If you have any questions or suggestions, please don't hesitate to comment down below or message me on my social media accounts. Thanks for watching. See you guys on my next vlog. Peace out. The voice.